I'm Dr. Nicola. I'll be the one that's carrying out your rotator cuff repair. So I've got you in for a pre-op today. Alright, it's lovely to meet you. So my love, can you confirm your full name? And your date of birth? Thank you. Now, can you confirm it's your left shoulder rotator cuff that I'll be repairing? Okay. That's good. Okay. Do you have any allergies? Okay. Now, have you had anaesthetic before? And did you have a reaction? Okay, so sickness. Okay. I could give you some anti-sickness then. Now, are you on any blood thinners? Okay, and are you on any other medication? Yeah. Okay, that's fine. Okay. Right, so any new symptoms? It's the same. Restriction, tightness, sore, painful. Okay, so no new symptoms. Okay. Okay, that's good. Right, can you just sign there for me to say that you agree for me to be doing your surgery? Thank you. Wonderful. Don't be nervous, my lovely. Okay, so I'm going to check your vitals to make sure you are well enough to have the surgery. Just checking you're not unwell at the moment. Okay, good. Just going to check your temperature, okay? Okay, that's good, but I'm just going to pop it in your ears just to double check, okay? Yeah, no fever, that's perfect. Okay, if I can have your index finger, please. Just relax it on the side for me. And this is just checking your oxygen levels and your pulse. Okay. That is absolutely fantastic. Your oxygen levels are amazing. And your pulse is quite nice and steady as well, so that's good. And, okay, I'll just take that from you. Okay. Check your blood pressure now. Alright. So if I could have this on. Slide it. Put your feet nice and flat on the floor for me, okay? And no talking. We'll go tight. pulse is good. Just going to double check the blood pressure again, just to be sure. That's perfect. So we had okay, wonderful. So your vitals are stable, so that's good. You are all good to go in that region. Okay. Right. Now, I'm going to have a look at your shoulder in a moment. Okay, so I know it's quite difficult for you, but could you just try to just shrug your shoulders for me? Okay, and can you just shrug? Okay, thank you. Okay. Now, can you lift this arm just slightly for me? Okay, and can you lift it as high as you can, but steady? Okay, all right. Relax. What about outwards? Okay. And make sure you relax now, lovely. I don't want you to cause any more damage. All right. Okay. I'm going to have a good look at that in a second. Okay. Lovely. So I'll get these on and I'll have a feel. Okay. Alright, if I can just have that there. That's it. All right. Okay. There's no obvious bruising. There is a bit of swelling though. And I know I've assessed before, but to make sure before surgery. Okay, I'm just going to move your shoulder a bit. Okay, just gently moving. Up, down. Okay. just look at this side. Yeah, I can see the difference in that already. Can we just feel across with a whole of shoulders and around. Yeah, I can definitely feel the swelling on that. Okay. I'm just going to move your arm. Okay, be gentle as possible. We need to tell me if it hurts anywhere, okay? Okay. Down. Okay. Can you hold my hand? Okay, squeeze. A bit more. Release. Squeeze. Release. Squeeze. Release. Okay. Same again. Squeeze. Harder. Release. Squeeze. Release. Squeeze. Release. Okay, do it at the same time. Squeeze. Release. Squeeze. Harder. Release. Okay, which hand do you write with? Okay. Definitely a lot weaker on this side, my lovely. Okay, has it hurt there? Okay. So obviously the cuff wraps around these tendons. And obviously you've torn it. So we need to repair that for you. That's why you've got the swelling and restricted movements, and yeah. It's just around there. Can you feel that when I touch? Does it feel numb at all? Okay, what about if I press slightly down the edge of your spine? What about around the scapula and the shoulder? Okay, and up. Okay. Okay, my love. Yeah. Okay. So I could definitely feel the swelling. You've got the pain, restriction, bit of numbness around there. Okay, a bit weaker that side as well. Okay, yeah. Let me just check with the exam. Okay, yeah. Yeah, just comparing when you had the examinations. Definitely say it's more swollen now, and definitely more restriction than when we first checked. But not to worry. Okay. If you could just roll your shoulder for me as best as you can. Okay, and what about the other way? Okay. Okay, and where's the pain at, my love? 1 to 10, 10 being the worst. Okay, what about when you move? Okay. So when I'm obviously moving it, I can feel the restriction. Yeah, I'm just going to wiggle it. Yeah, alright. And just move that a little bit. Just going to push it back. Okay, alright. Pull it towards me. And out a bit. And try and pull it up. Right, yeah, definitely too much restriction there. Okay, my lovely. Okay. Alright. So obviously I can feel that, you know, you're a lot weaker this side. Do you find that you are? And would you say it's definitely a lot weaker than you would be normally? Yeah, I thought so. Alright, but I just want you to do something for me, okay? Put my hand there. Now can you push just through that side? Push me. Okay, I'm going to gently push you back and push. Okay, I can feel your hesitation. Both together. Okay, if you push me. Okay, now I'm going to push you back. Push, push. Okay, fine. Relax. Yeah, okay. Definitely weaker that side. Yeah, I think some of it is probably anxiety, but there's definitely physical weakness there. Yeah. I mean, obviously when we did the scans and obviously I did all the checks before, it was obvious. But this is just to you know, clarify everything and see if it's actually gotten worse since. Okay, so. Okay, so. Just checking. This here, we just angle slightly the other way. That's it. Just squeeze that. Just check your circulation. Okay. And your capillaries, I'm just going to squeeze and release. Squeeze, release. Let's feel around. Good. Pulse that fine. Okay. Circulation is all intact there, that's perfectly fine. Okay, you can just have your arm just to check down. And your hand. You feel everything I'm doing. Okay, that's good. That's all fine. Okay, that's good. All feels nice. Right, if you could just breathe for me normally. I'm just going to monitor your breathing. Can you breathe a bit deeper? Okay, now take a nice deep breath in and out. Okay. I'm going to listen to your chest now. Okay, I could just get down. Okay, we'll feel a bit cold. Just normal breathing. Okay. Take a nice deep breath in for me. Hold it. Out. In. Hold it there. And out. Take a nice deep breath in. Out. Okay, now I'm going to take it around the back. Normal breathing. Can you just take a nice deep breath in? Out. Okay, other side. Normal breathing. Take a nice deep breath in. Hold it. And out. Okay. Just back there for me. Okay. If I could just have your wrist. Perfect. Your heart sounds really strong, nice normal rhythm. Lungs sound nice and clear. Good. Deep breaths. Okay. So all normal there. Okay. Right. Can I touch your face? Thank you. So just go around your jaw. Alright. Can you open, close, open, close? Can you chew? Okay, great. Open your mouth as wide as you can. And close it. And open. Put your tongue out. Okay, say ah. Okay, I'm going to pop in the depressor. Okay, looking at the back of your throat. Can't see any redness or swelling or any ulcers. That looks good and nice and clear. Say ah. Good. Wonderful. That is perfect. So, mouth is clear. Airways are clear enough for the anesthetic, which is wonderful. I'm going to mark your shoulder off in a moment. Confirm it is your left that I'm repairing, which is this side. Good. Okay, so I'm just going to go and mark up your shoulder. Relax for me. Okay, happy with that. Just move your arm up and down. Relax. Okay. So your gown is right there, which is what you will need to wear, okay? And socks are next to it as well. The nurse did take your measurements for that, so they're all correct sizing. So we've confirmed the identity and the procedure. You've signed, I've marked you up, your vitals are stable, airways are clear. Your circulation is all intact in that area. You are medically fit for surgery. Okay. So, okay, how are you feeling? All right, so everything's fine. I am happy to carry out the procedure. All right, my lovely. You're in perfectly safe hands. Okay. Now, you will be staying in overnight. And that's just to see how things are. So I'm going to pop you on your band. If I could have this on. Thank you. So this is you officially admitted to the ward. Okay, there we go. So what I would like you to do is I will leave you in a moment, okay, and you can get yourself changed and then get yourself on the bed and just relax, okay? The anaesthetist will then come round and get you and take you down to theatre, all right, then we'll prep you and then we'll do the surgery. Okay, and then when you've come round in recovery, we'll take you back up to the ward, get yourself settled in and get you some food. And obviously you will be having some anti-sickness as well, so don't worry about that. Okay, but you've got a fantastic team around you. Everything's going to be fine. Okay, it's very straightforward. And, you know, I've done hundreds of these type of procedures. I have a very, very good result, so you'll be fine. All right, my lovely. You're very welcome. Do you have any questions at all? Don't worry, we will be giving you pain relief, yeah, because you will be in quite a lot of pain, because you are already, so when we've been messing and then fixing, you will be in pain, so we will be giving you some, so don't worry about that, my love. All right, okay, and then obviously you'll be staying in and you'll be monitored, so yeah. All right, my love, well, I'll let you get yourself changed and I'll see you down theatre. All right. Take it easy. I'll see you soon.